Is the nurses' union looking for more than just a raise?
Yes, they're concerned about staffing levels. Twin Cities hospitals agree that having the proper number and type of nurses is critical to providing quality patient care and safety 24/7.
Okay, so what separates the two sides?
The nurses' union is seeking to control how decisions are made to staff up, which could then lead to mandatory specific nurse-to-patient ratios. The hospitals prefer to leave staffing decisions in the hands of the people who know patients best, nurse leaders with input from the patient's care team.
Wait, what's a care team?
Patient care is delivered by a team that includes more than nurses, including physicians, nursing assistants, therapists, dietitians, and more. A mandatory nurse-to-patient ratio doesn't allow for the teams to adapt to the needs of individual patients. The ability to provide continuous care requires that hospitals have flexibility when scheduling employees, regardless of their role. Take the pandemic, for example. It was staffing flexibility, which allowed the hospitals to successfully treat patients during COVID.
But more nurses mean better care, right?
It's easy to think so. Nurses are the backbone of the care team. Yet despite multiple academic studies throughout the country, no one has identified a definitive staffing level required to ensure quality outcomes. Instead, staffing is inherently dynamic and needs to be constantly adjusted based on the needs of the patient, the experience of the care team, length of stay, and other important factors.
Okay, so is this fair to the nurses?
The hospitals believe so, yes. As we've seen, a strict nurse-to-patient ratio undermines team-based care. So it's not a question of more nurses, it's a question of who gets to decide how many nurses to staff.
Okay, so what's the bottom line?
Twin Cities hospitals value and respect nurses and understands how difficult the last couple of years have been. Still, every day, nurse leaders, including union nurses, work to appropriately staff units based on individual patient needs and on the training, experience, and capabilities of the care team. It's a system required to provide patients with high-quality care. To learn more, visit TwinCitiesHospitals.com.